Our next speaker is a vice chairman of a pharmaceutical company that has grown from strength to strength, always exemplifying the entrepreneurial formula for growth. He's here to share his company's vision and dreams of innovation. Ladies and gentlemen, please join me in welcoming the vice chairman of Lupin, Dr. Kamal Sharma.
I'll very quickly like to touch upon what Lupin has been doing in this area. Way back, Lupin is about a 47-year-old company. Way back in 1988, we started Lupin Health and Welfare Research Foundation. Currently, this foundation touches about 2 million people in the country. The promoter, chairman of the company comes from Rajasthan, so the first experiment was started in Rajasthan. And thereafter, we expanded this program into most of our manufacturing centers in the vicinity there. So you have this program going in Gujarat, in Maharashtra, in Madhya Pradesh, and this is a very, very successful program. We have just created a Happy Lung Alliance with some of the chest physicians. Currently, there are about 270 spirometers that we give out to the doctors for testing the lung capacity, and they are able to diagnose asthma and COPD. With the help of that. We also have our own spiromen. In Lupin, there are about 150 at the moment who go to different clinics where the spirometer is not available, and they test for asthma and COPD. So that's a very interesting initiative which is going on at the moment. In cardiovascular illness, I think with collaboration with the European Society of Cardiology, we have built 23 clinics to educate people on heart failure. And I was telling you this, that a lot of people die because they do not understand that they are actually having a compromised heart, and they continue to do things which otherwise they should not do. And this is picking up an excellent experiment today. Similarly, we have another program called Humrahi, where we have 31 educators in the field who are educating people in camps about the awareness of diabetes and how to prevent it. And we believe very firmly in our company that it is the awareness which is eventually going to help the entire cause of good health delivery. Tuberculosis, you might know that Lupin started with tuberculosis as this early entry. I think the commitment of the chairman at that time was to provide, because this has been a very debilitating illness, and unfortunately, despite such long history, we still have 20% of world TB cases in our country. And similarly, we have plenty of chronic disease camps all over the country to make sure that people are educated about prevention, about better health care, and about better diet, nutrition, exercise, so that they do not have they do not have to go through the illness itself. I just wanted to share with you the case study on tuberculosis, because that has been one of the oldest commitments of the company in the country. As you might be aware, there are 8.6 million people in the world who suffer from TB. 20% of that load is in India. There are about 940,000, short of a million deaths which happen because of tuberculosis. And again, 20% of that is in our country. Today, we are the world leaders in tuberculosis. We have almost like 54% of the world market. Not only in India, we also supply huge quantities of anti-TB products to GDF, that is WHO, and also to the other programs under the Global Fund for Eradication of TB, Malaria, and AIDS. The latest that we have started working in this area is a program called LIMIT, which is Lupin's initiative for managing TB in India. And this was because we continuously keep thinking as to how to improve the awareness of people and the kind of delivery of healthcare. What we found here is that out of the 4 people who suffer from tuberculosis, only 1 is detected, and 3 go undetected, who go and then infect other people. And that is why this is spiraling, this whole, despite whatever I've spoken about. And therefore, we started a program. We have taken help of government bodies as well. And Lupin is in the front of this entire initiative. And before we roll out at the national level, we have just taken a pilot. This is as recent as about 6 months old initiative. We have taken a camp in Govandi, and we are doing this entire education program in Govandi, in Dharavi. So once we get a complete understanding of how people are receiving it, what all fine-tuning is needed, we intend to roll this out at the national level. So I think Dr. Panda mentioned that at the end of the day, whatever we do, all our actions put together, be it in infrastructure investment, be it in medicines, be it in education, I think we should be able to deliver value care. And what is value? Value is worth divided by the cost. So it should be worth the money that I pay. And I think the attempt of all of us who are connected with the healthcare should be that. That's the presentation that I want to make to you. Thank you very much. Thank you.
Catch the brightest minds from the healthcare industry speaking about how they have made a difference to the healthcare sector positively.
Focus, ideate, innovate, enable.
Presented by ICICI Lombard Health Insurance. Journal partner, The Indian Practitioner. Exclusive media partner, Medgate. Magazine partner, Drug Today Medical Times. And Healthcare Executive. On-ground partner, Inox.